you for your interest in the meeting today. We unfortunately had a little bit of a mix-up with the invitations, and although our presentation is tailored to systems-level stakeholders, we hope we'll share this information, and also the Child Care and Development Fund grantees, who are the states, territories, tribes that run the child care subsidy and quality improvement programs in each state, rather than providers who have been, some of them, invited to the call. We're going to try to make the information work for everybody. We received an outpouring of questions related to a range of important child care topics in preparation for this call, including topics such as payment practices and financial concerns, serving the children of essential workers, how to decide when to close a program, when and if it's safe to reopen, appropriate health and safety procedures to follow when open, and where to find personal protective equipment. Well, all these questions are important, and we will try to answer them at another time. The topic of today's webinar with the CDC is their health and safety guidance. They will try to tackle the questions related to general health and safety during this emergency, but questions that are specific to individual provider experiences and in vastly different state contexts will not be covered. For the provider, for the providers on the call who may be less familiar with CCDF programs and the recent supplemental funding, we point you to our website, which I see that Ellen has posted in the chat, acf.hhs.gov/OCC. You click on Review the Resources, you'll find all sorts of COVID-related material that describes what states, tribes, and territories can do within the flexibilities of this program. I might also add, if they did everything that they could do with this program, they would be broke in quick measure. So it's still worth taking a look there so you know what's possible in your state, and you might want to talk to some of your state leaders about which are the most important pieces for you. But the key to remember is that the funding that is managed by the Office of Child Care goes directly to state, territory, and tribal governments by formula, and they design their jurisdiction's child care, which includes subsidy and quality improvement pieces, program within the limits and flexibilities allowed under federal law. In addition, a supplemental appropriation, extra money, was allocated to help states, territories, and tribes address child care needs related to COVID-19. For a funding update, I'm going to turn this to Andrew Williams, our Policy Director. Andrew? Did you all know I was going to let Andrew speak?
Yes.
Okay,
yes. Hi.
Go ahead, Andrew.
Good afternoon. So Shannon said there was a supplemental appropriation, and that was provided under the Coronavirus Aid, Relief, and Economic Security Act, or what we call the CARES Act. And it provided, as Shannon said, additional funding and flexibilities for CCDF lead agencies to address child care needs during this time. It provided an additional $3.5 billion to states, territories, and tribes, and that money was awarded today. That's in addition to the $8.7 billion in regular CCDF funding that states and territories and tribes receive. This supplemental funding can be used for continued payments and assistance to child care providers in the case of decreased enrollment or closures, to help them be able to remain open or reopen to maintain the supply of child care. It can be used for cleaning and sanitation and other activities to maintain or resume the operation of programs. It can be used for child care assistance to healthcare sector employees, emergency responders, sanitation workers, and other essential workers without regard to the regular income eligibility requirements. And it can be used for other allowable CCDF purposes. We are working on guidance regarding the use of that funding, which we anticipate will be available within the next few days. And that will be posted on our website along with other resources at the link that Shannon mentioned and that Ellen typed in the chat.
Great. Thanks, Andrew. Lastly, I want to mention that it's also important for everyone, including providers, to understand that there are multiple sources of funding available from different parts of government that are related to child care, and you'll need to seek out that information. It's complicated. We're going to try to put some things together that help with that, but you might not want to wait. So ferreting out that information by contacting your own state may be more helpful. You could reach out to your state CCDF administrator or keep an eye on your associations and other organizations that you track for state and national information. We're also wanting to link you to the CDC webinar with Child Care Aware of America that was earlier this week, and that contains a lot of the same guidance that we're going to have on this call, but a little more tailored to providers. And that link, if it's not on the screen, Ellen Wheatley, my deputy, will put it in the chat box. And then also to make sure that you have access to the documents that CDC has put out on this topic, which will also be in the chat if not on the screen. So with that, I will turn it over to Francesca Longo in our Operations Division to introduce our guest.
Thank you, Shannon. Can everyone hear me? Great, thank you. So welcome. I would just like to say thank you to the CDC for joining us today, and in particular, Dr. Alexandra Levitt. Dr. Levitt is a health scientist in the CDC Health Science Communication Office, the National Center for Emerging and Zoonotic Infectious Diseases. Since joining the CDC in 1995, she has coordinated policy reviews and initiatives in such areas as global health, outbreak assistance, and bioterrorism preparedness, and contributed to interagency strategies and implementation plans that address antimicrobial resistance, pandemic influenza, healthcare-associated infections, and biological threats. Alexandra began her government career as an American Association for the Advancement of Science, AAAS Diplomacy Fellow, in good company, assigned to the U.S. Department of State, where she coordinated a government statewide review of the global health and security threat posed by emerging infectious diseases. The findings of that review became the basis of the first presidential decision directive on global infectious disease policy. Alexandra holds a PhD in biology from Columbia University and formerly served on the faculty of the New York University Department of Medical and Molecular Parasitology. So you can see we are in great hands today with Dr. Levitt, and so I will turn it over to her to provide some context about the Centers of Disease Control and Prevention guidance.
Hi, thank you very much. I'd like to thank all of you at the Administration for Children and Families, which is our sister HHS agency, for the opportunity to speak about CDC's guidance on child care programs that stay open during these very challenging times. So the CDC guidance can apply to many types of child care programs, including family child care programs, also known as home-based child care, pre-kindergarten programs at private and public schools, Head Start and Early Head Start programs, private child care centers, temporary child care centers for the children of essential service providers, including first responders, healthcare workers, transit workers, and or other industries, where a parent cannot stay home. Child care centers that partner with healthcare facilities, this is another, in the end of my list, child care centers that partner with healthcare facilities to support healthcare workers who need child care. CDC has updated this guidance mostly around ways to screen children on arrival for signs of illness, and I will describe that in a few minutes. This updated guidance was posted just last Sunday night. The CDC guidance begins by discussing general preparedness and planning. The main message is, regardless of the level of transmission in a community, child care programs should have a plan in place to protect staff, children, and their families from the spread of COVID-19. CDC recommends that the plan should address these issues. First, preventing the spread of COVID-19 by encouraging staff to take everyday preventive actions, such as washing hands, covering coughs and sneezes, cleaning and disinfecting frequently touched surfaces, covering mouth and nose with cloth face coverings when you have to go out in public, and planning to ensure adequate supplies to support these steps. Also, requiring sick children and staff to stay home. Establish procedures to ensure that children and staff who come to the child care center sick or become sick while at your facility are sent home as soon as possible. Plan to have an isolation room or area, such as a cot in a corner of the classroom, that can be used to isolate a sick child. It is important to keep sick children separate from well children and staff until they can be sent home. It's also important to monitor and plan for absenteeism among staff, such as by securing extra substitutes, and to review plans for implementing social distancing strategies, avoiding mass gatherings, and limiting non-essential visitors. The guidance for child care programs to remain open includes information on these topics: social distancing strategies, cleaning and disinfection, parent drop-off and pickup, caring for infants and toddlers, healthy hand hygiene, and food preparation and meal service. And I will briefly review the information under each of these headings. Social distancing strategies. Child care programs that remain open during the COVID-19 pandemic should implement social distancing strategies such as having each classroom include the same group of children each day with the same child care provider, canceling or postponing special events such as festivals and holiday celebrations, halting or altering group activities, for instance by staggering playground times, spacing out children's nap time mats or cribs as much as possible, and also if possible, having administrative staff telework. Cleaning and disinfection. Child care programs should intensify cleaning and disinfection efforts. Routinely clean, sanitize, and disinfect surfaces and objects that are frequently touched, especially toys and games, and objects and surfaces that are not ordinarily cleaned daily, such as doorknobs and light switches. The cleaning and disinfection section of the guidance also provides a link to instructions for selecting appropriate sanitizers and disinfectants, and detailed information on cleaning and sanitizing toys and cleaning and disinfecting bedding. Toys that cannot be cleaned and sanitized should not be used. Okay, parent drop-off and pickup. Child care programs should modify procedures for drop-off and pickup. Provide hand hygiene stations and sign-in sheets at the entrance of the facility so children can clean their hands before they enter. Place sign-in sheets outside and provide sanitary wipes to clean pens between each use. Stagger arrival and drop-off times if possible, and or plan to limit direct contact with parents as much as possible. Have the same parent or designated person drop off and pick up the child every day. If possible, children should be screened on arrival. Children who have a fever of 100.4 degrees Fahrenheit or above, or other signs of illness, should not be admitted to the facility. Encourage parents to be on the alert for signs of illness in their children and to keep them home when they are sick. The updated guidance posted on Sunday describes 3 ways to safely screen children upon arrival, and I'll come back to that at the end of my talk. Okay, caring for infants and toddlers. The CDC guidance also addresses issues related to caring for infants and toddlers, including procedures for diapering young children. The CDC guidance recognizes that social distancing is challenging when caring for infants and toddlers. To the extent possible, when washing, feeding, or holding very young children, it is suggested that child care providers wear an overlarge button-down long-sleeve shirt and clip-back long hair, wash any body part touched by a child's secretions, and change their own clothes and the child's clothes if secretions are on them, and wash their hands. Place contaminated clothes in a plastic bag or washing machine. It's also recommended that child care providers wash their hands before and after handling infant bottles, whether they're prepared at home or prepared in the facility. Bottles, bottle taps, nipples, and other equipment used for bottle feeding should be thoroughly cleaned after each use by washing in a dishwasher or by washing with a bottle brush, soap, and water. Healthy hand hygiene. All children and staff should engage in healthy hand hygiene behaviors. Wash hands with soap and water for at least 20 seconds or with hand sanitizer if soap is not available. Assist children with hand washing, including infants who cannot wash hands alone. Supervise children when they use hand sanitizer to prevent ingestion. Place posters describing the hand washing steps near the sink. Finally, food preparation and meal service. Extra precaution should be taken around food preparation and meal service. The recommendations are: serve meals in classrooms. Food preparation should not be done by the same staff who diaper children. Sinks used for food preparation should not be used for any other purpose. Caregivers should ensure that children wash hands prior to and immediately after eating. And caregivers should wash their hands before preparing food and after helping children to eat. The CDC guidance also addresses issues related to protecting people at higher risk for severe illness from COVID-19. Based on currently available information and clinical expertise, older adults and people of any age who have serious underlying medical conditions may be at higher risk for severe illness from COVID-19. To protect those at higher risk, it's important that everyone practices healthy hygiene behavior. If you have staff members or teachers aged 65 or older, or with serious underlying health conditions, encourage them to talk to their healthcare provider to assess their risks and to determine if they should stay home. Information about COVID-19 in children is somewhat limited, but the information that is available suggests that many children have mild symptoms. However, a small percentage of children have been reported to have more severe illness. If you have children with underlying health conditions, talk to their parents about their risks. Also, continue to follow children's care plans for underlying health conditions, such as an asthma action plan. Finally, if you have children with disabilities, talk to their parents about how their children can continue to receive the support they need. Okay, the CDC guidance lists additional resources at the end that you might find helpful. The CDC COVID-19 website contains a variety of resources for child care programs in K-12 schools, including frequently asked questions for administrators, teachers, and parents. Together, these resources provide additional information on what to do if a child or staff member at your facility becomes sick, and also about closures of child care programs. The resources emphasize that any decision about temporary closures of child care programs should be made in coordination with your federal, state, and local educational officials and with state and local health officials. Child care programs are not expected to make decisions about closures on their own. Okay, now I would like to return to the issue of how to screen children on arrival to ensure that children who are sick are not admitted to the facility. The updated guidance provides 3 detailed examples of how a child care program can safely screen children upon arrival for fever and other signs of illness. The first example involves reliance on social distancing. The second relies on barrier or partition controls. And the third, which was provided in the original guidance, relies on using personal protective equipment, or PPE. That last option may still be used if supplies of PPE are readily available and if your staff is trained in using PPE and is comfortable with using PPE. In regard to the example involving reliance on social distancing, the updated guidance says, Ask parents or guardians to take their child's temperature either before coming to the facility or upon arrival at the facility. Upon their arrival, stand at least 6 feet away from the parent and child and ask the parent to confirm that the child does not have fever, shortness of breath, or cough. Make a visual inspection of the child for signs of illness, which could include flushed cheeks, rapid breathing or difficulty breathing, fatigue, or extreme fussiness. You do not need to wear personal protective equipment if you're able to maintain a distance of 6 feet. Okay, in regard to the second example involving reliance on barrier or partition controls, the guidance says, during screening, stand behind a physical barrier, such as a glass or plastic window or partition, that can protect your face from respiratory droplets that may be produced if the child being screened sneezes, coughs, or talks. Make a visual inspection of the child for signs of illness and then conduct temperature screening using this protocol. Wash your hands and put on disposable gloves. Check the child's temperature reaching around the partition or through the window. Make sure your face stays behind the barrier at all times during the screening. In conclusion, I want to reiterate my thanks to ACF and all of our child care partners, and we hope that you will find the updated guidance helpful. Thank you very much.
Thank you, Dr. Levitt. That was just so useful and so helpful. And I believe we are also joined by Shelby Ree also from CDC Community Intervention Partnership to lead us through some more question and answers. Shelby?
Yeah, I'm here. Can you hear me?
Yes.
Perfect. Yes, so I will ask some questions that were previously submitted to the CDC from this group and other questions that we have received about this guidance that we get frequently enough that we feel merit answering. So first question for Dr. Levitt. How should we be using CDC guidance? It seems like the guidance in my state is stricter than what is in your document. I also have seen that CDC made updates to guidance. Should we expect more changes? Should I be following the rules in my state, or should I follow what CDC says?
Thank you, Shelby. That's a good question. CDC develops guidance based on the best scientific data about SARS-CoV-2, the virus that causes COVID-19 illness. Just a few months ago, I guess 4 months ago, no one knew this virus even existed. The body of evidence about COVID-19, therefore, is still small, but growing, and CDC updates guidance as we learn more about the disease. That's why all of our guidance is considered interim, because it will be updated as we learn more. I can also say that CDC guidance are science-based recommendations rather than directives. CDC does not have regulatory authority in this area. State and local authorities have ultimate responsibility to implement and enforce public health measures, and these may include shelter-in-place or stay-at-home orders, limitations on group gatherings, and/or the ability to access goods and services deemed non-essential. In some places, child care is considered essential, or child care specifically for health workers, first responders, and other essential workers. State and local governments have ultimate authority over what businesses and industries are deemed essential. CDC guidance does not supersede state, local, tribal, or territorial authority.
Your passcode. Your passcode is confirmed. Thank you. And now our next question is, how can we find adequate supplies to support hand hygiene behaviors and routine cleaning of objects and surfaces? Dr. Levitt, if you're speaking, we can't hear you.
Can be found at the resource webpage of Child Care Aware of America. So I hope that helps.
Dr. Levitt, you were muted for half of that answer. Do you mind answering the question again?
Okay, sorry about that. Okay, so if you have difficulty in obtaining these supplies, our advice is to contact your local child care resource and referral agency, that's also known as a CCR&R agency, to learn more about service organizations in your community that may have additional resources. Your local CCR&R agency can be found at the resources page of Child Care Aware of America, the web page I meant.
Thank you. The next question is related to children wearing masks. What should providers do for children related to wearing masks? Is it recommended that all children 2 years or older wear cloth masks? I know that is the general recommendation for children in public spaces, but it is unclear if child care settings would be considered such.
Okay, well, first, we need to distinguish between masks, which refer to surgical or N95 masks, and cloth face coverings, which are recommended by CDC for use in community settings. Surgical masks and N95 respirators are in short supply and should be reserved for healthcare workers or other medical first responders, as recommended by CDC guidance. The updated CDC guidance for child care programs that remain open recommends that, when feasible, and I emphasize when feasible, staff members and older children should wear face cloth coverings within the facility. However, cloth face coverings should not be put on babies and children under age 2 because of the danger of suffocation. So I hope that helps.
Thank you. Next question. If a provider or a child is in the high-risk group of severe outcomes from COVID-19 because of age or existing health concerns, should they be excluded from providing care or attending a child care program?
Okay. Children and adults with serious underlying medical conditions, as well as older adults, are believed to be at higher risk for more serious complications from COVID-19. To protect those at higher risk, it's important that everyone practices healthy hygiene behaviors. If you have staff members or teachers age 65 or older, or with underlying medical conditions, encourage them to talk to their medical provider to assess their risk and to determine if they should stay home. I don't know if you also asked about children, but yes, you did. Okay, well, information about COVID-19 in children is somewhat limited, but the information that's available suggests that many children have mild symptoms. However, a small percentage of children have been reported to have more severe illness. So if you have children with underlying health conditions, talk to their parents about their risk. Also, follow children's care plans for underlying health conditions, such as an asthma action plan. And also, if you have children with disabilities, talk to their parents about how their children can continue to receive the support they need.
Excellent. What if a child becomes ill while in care? How do we best care for them while they wait for parents to pick them up?
Okay, well, the CDC guidance recommends, as you know, that child care programs require sick children and staff to stay home. It's important to establish procedures to ensure that children and staff who come to the child care center sick or become sick while at your facility are sent home as soon as possible. The guidance says, keep children and staff separate from keep sick children separate from well children and staff until they can be sent home. Plan to have an isolation room or area, such as a cot in the corner of the classroom, that can be used to isolate a sick child. Have the child rest in the isolation area until the child can be picked up. If a sick child has been isolated in your facility, clean and disinfect surfaces in your isolation room or area after the sick child has gone home. There's additional information about isolation and related settings can be found in CDC guidance on the web. There's guidance about isolation at home and isolation in healthcare settings.
Thank you. What do I do if a case of COVID-19 is confirmed in a child or staff member? How do I disinfect a facility?
Okay, well, if COVID-19 is confirmed in a child or staff member, you should close off the areas used by the person who is sick. You should open the outside doors and windows to increase air circulation in those areas, and then wait up to 24 hours or as long as possible before you clean or disinfect to allow respiratory droplets to settle before cleaning and disinfecting. Then clean and disinfect all areas used by the person who is sick, such as offices, bathrooms, and other common areas. However, if more than 7 days have passed since the person who is sick visited or used the facility, additional cleaning and disinfection is not necessary. Finally, sick staff members should not return to work until the criteria in the CDC guidance on discontinuing home isolation have been met.
Thank you. What criteria should I follow when deciding to send a child home?
Okay, well, sick children should be required to stay home. If a child has a temperature of 100.4 degrees Fahrenheit or above, or is displaying any signs of illness, including cough or shortness of breath, they should be sent home. Other signs of illness in a small child may include flushed cheeks, fatigue, or extreme fussiness. You should establish procedures to ensure that students and staff who become sick at school, who arrive at school sick, are sent home as soon as possible. Keep anyone sick separate from well children and staff until the sick child can be picked up.
Thank you. And for infants and toddlers, specifically, how can you practice social distancing with children those ages?
Okay, well, I'm going to answer that by talking a little bit generally about social distancing and then focus in on the smallest children. You should work with your local health officials to determine a set of strategies appropriate for your community situation. You might consider the following social distancing strategies. If possible, child care classes should include the same group each day, and the same child care provider should remain with the same group each day. If your child care program remains open, consider creating a separate classroom or group for the children of healthcare workers and other first responders. If your program is unable to create a separate classroom, consider serving only the children of healthcare workers and first responders. Limit the mixing of children to the extent possible, such as by staggering playground time and keeping groups separate for special activities such as art or music. If possible, at nap time, ensure that children's nap time mats or cribs are spaced out as much as possible, ideally 6 feet apart. Consider placing children head to toe in order to further reduce the potential for viral spread. Also consider staggering arrival and drop-off time and/or have child care providers come outside the facility to pick up the children as they arrive. Your plan for curbside drop-off and pickup should limit direct contact between parents and staff members and adhere to social distancing recommendations. Now, it's important, of course, to comfort crying, sad, and/or anxious infants and toddlers, and they often need to be held. To the extent possible, when washing, feeding, or holding very young children, child care providers may protect themselves by wearing an overlarge, button-down, long-sleeve shirt and by wearing long hair up off the collar or in a ponytail or other updo. Child care providers should wash their hands, neck, and anywhere touched by child secretions. Child care providers should change the child's clothes if secretions are on the child's clothes. They should change the button-down shirt if there are secretions on it and wash their hands again. Contaminated clothes should be placed in a plastic bag or washed in a washing machine. Infants, toddlers, and their providers should have multiple changes of clothes on hand in the child care center or home-based child care. Child care providers should wash their hands before and after handling infant bottles prepared at home or prepared in the facility. Bottles, bottle caps, nipples, and other equipment used for bottle feeding should be thoroughly cleaned after each use by washing in a dishwasher or by washing with a bottle brush, soap, and water. So we recognize this is difficult, and we hope that this will help some.
Thank you. Why is it important to keep children in stable groups?
Keeping children in stable groups minimizes the risk of transmission to the larger group of children who may be receiving care in the same facility. Additionally, if a child becomes ill and the child was kept in a stable group, providers and parents will more easily determine which other children were exposed.
Thank you. How do we know when it's safe for providers to go back to work after recovering from COVID-19?
Staff members should not return to work until they have met the criteria and CDC guidance on when to discontinue home isolation. Child care program administrators may also refer to CDC's interim guidance for businesses and employers to plan and respond to COVID-19. And there's more information there. The decision to discontinue home isolation should be made in the context of local circumstances. Current options include a test-based strategy and a non-test-based strategy that takes into account the time since illness onset and the time since recovery. So I'm going to briefly go over those things. The test-based strategy is contingent on the availability of ample testing supplies and laboratory capacity, as well as convenient access to testing. The non-test-based strategy says that at least 3 days must have passed since recovery, which is defined as resolution of fever without the use of fever-reducing medications, and also there should be improvement in respiratory symptoms. So that should be at least 3 days. All of that should have resolved. And also there should be at least 7 days passed since your symptoms first appeared. And again, I refer you to the written guidance on the web on home isolation. Thanks.
Thank you. And for our final question, we will ask the final question is, if a member of a family has symptoms of COVID-19, should the other members of that family stay at home?
Okay. Well, if you or someone in your home might have been exposed to COVID-19, you should definitely stay home and self-quarantine and self-monitor. You need to be alert for symptoms, to watch for fever, cough, or shortness of breath. You should take your temperature twice a day. You should practice social distancing, maintaining 6 feet of distance from others, and stay out of crowded places. And then if you should follow the CDC guidance if symptoms develop. Now, if you feel healthy but recently had close contact with a person with COVID-19, which could be a household member, intimate partner, or an individual providing care in a household without using recommended infection control precautions, then you should check your temperature twice a day and watch for symptoms. You should stay home for 14 days and self-monitor. And if possible, you should stay away from people who are high risk for getting very sick from COVID-19.
Thank you for answering these questions, Dr. Levitt. It's been very helpful, I think, for us. And now we will pass back to Francesca Longo. Thank you.
For the participants, if you will give Francesca just a minute to get the audio working again, please.
Can folks hear me now?
Yes,
Yeah.
Francesca.
Okay, great. I needed to call back in. Sorry about that, everyone. We've got a couple questions that came in over the chat. Not sure if we want to address, we saw definitely one about the other children in the family, so thank you for answering that one, Shelby and Alexandria. There's a question here about if there's any guidance for children that have other conditions that mimic symptoms of COVID-19, such as high basal temperature. I'm not really sure if there is anything on that, but if Alexandra or Shelby.
Oh, I'm sorry. I didn't realize. So you're asking again about the high-risk groups?
So I think the question might be if there's a group, if there's a high-risk group, or if there's a child who has a condition that mimics high temperatures, how can they, how many providers be able to discern that difference?
Our advice is to talk to the child's parent and have them reach out to the child doctor, the child's health care provider, because there's a possibility that whatever illness, the underlying illness the child has, it may make them more susceptible to severe illness. So our guidance across the board is to, if you know that one of your kids has an illness, no matter what it is, talk to the parents and have them consult with a doctor.
Thank you. So I think we've answered most of these other questions that have come through, and I'm sensitive that we are nearing the end of time here. So there's a question coming in about guidance on coaches or monitors visiting the centers. I'm not sure that that is something that it's not quite a question. So if Tracy Fuller would like to clarify.
I'm sorry, Francesca, is this directed to me?
No, I'm sorry, Alexandra. I would like to,
It's okay.
There's one more question before we turn it over and say thank you, but I think I'm not sure what the question is, so it would be great to just get clarification, and I believe Tracy is typing right now. And I believe the question relates to any visitors who might come to the center or to work with teachers. I would, and Alexandra, I would assume that that might be similar to any other person who might be working in the center, the precautions that they might take.
I think that if there is transmission high in your community, most likely you should try to limit non-essential visitors, and mostly, I can't speak for every child care group, but usually volunteers are not considered essential. So most likely you would consider them non-essential visitors and ask them not to come.
Okay, and for other visitors that might not be volunteers, but that might be other visitors that might need to come into the space.
Well, you would have to. Can you hear me? I apologize.
Oh,
hello?
No worries. We can now.
Okay, sorry. My phone is driving me crazy. Okay, I was about to say that you would have to make a judgment on, usually it's best not to let in anybody non-essential and to limit volunteers. So you'd have to make a judgment call on how important it was to let in this particular volunteer. Because the general guidance says not to have extraneous people because each person, sad to say, is a potential source of contamination.
Thank you. So yes, limiting volunteers is recommended. Okay, well, yes, thank you, Ellen.
So I was just wanting to thank everyone, especially thank OCC Director Shannon Christian for her introduction. I wanted to thank Dr. Left for all of the really important information. I want to thank Shelby Reeve for all of the work she's done, and to let everyone know that this is the end of her rotation through the COVID work for CDC, and we want to let her know how much we appreciate everything she's done. And I especially want to thank Francesca. Francesca Longo worked through all of the logistics of this webinar and should be congratulated for making sure that it's a success. So thank you very much, Francesca.
Thank you for all of the good turns. Thank you.
And I believe we are at the end of our time. Does anybody want to put in the last word? Okay, thank you very much, everyone. And please look for the recording of this webinar that will be on the Office of Child Care COVID-19 webpage. And you can also go directly to the CDC guidance through that OCC COVID-19 webpage. So a lot of really good resources there, so please take advantage of them. And thank all of you. Have a good day.
Thank you.
Thank you.